I want to tell you the one step that you can take to prevent deaths from exertional heat stroke in sports like football. I'm Dr. David, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Exertional heat stroke is one of the more common causes of death in sports. In high school and college football, it's the third most common cause of death after cardiac death and brain injuries. So it's not that common, but it can happen, and it's something that we need to be aware of. Now, there's all sorts of steps we could take to prevent it in terms of acclimatization guidelines and gradually working into the heat and pads, and all of that's great, and I talk about that in other places. But I want to talk about one step that basically you can take if you work with athletes and active people to prevent an athlete that goes into exertional heat stroke from dying. We know that athletes, roughly, when they go into exertional heat stroke on the field, their core body temperature is probably about 108 degrees Fahrenheit. And you have about 30 minutes to get that body temperature down to 104 degrees Fahrenheit. Obviously, you're going to want to get it lower at some point, but you want to get it below 104 degrees Fahrenheit within the first 30 minutes. And you have to factor in that it's probably going to be a few minutes, maybe 8 to 10 minutes, before you even recognize that the athlete's having problems. That's one of the reasons I think it's critically important that organized sports teams have athletic trainers, not just at games, but at practices, because the coaches have too much going on to monitor every single athlete. They should be monitoring, I'm not saying they're not, but you want to have an athletic trainer, not just for the treatment of exertional heat stroke and other problems, but to watch for athletes and get this thing started. So the first thing you're going to do as an athletic trainer is take a core body temperature with a rectal thermometer. That's the best way to assess core body temperature. Yes, then at that point, again, let's just assume for a second that that core body temperature is 107, 108 degrees Fahrenheit. Yes, you're going to call 911 and have EMS arrive, but you're going to start treatment on site. Before they're ever transported, you're going to do cold water immersion with ice baths or cold water whirlpools or something. You're going to do that before you wait for the ambulance, before they go to the hospital. You've got to get their core body temperature down below 104 degrees Fahrenheit. Then they can be transported to the hospital. The problem with waiting on an ambulance and then waiting for that ambulance to transfer the patient to the hospital is it takes too long. It may take 5, 10, 15 minutes for the ambulance to get there, another 5, 10 minutes for the paramedics to assess them, and then get them loaded onto the ambulance, and then get taken to the emergency room, then get assessed at the emergency room by the nurses and the doctors. All that's going to take way longer than 30 minutes. And if they're above 104 degrees Fahrenheit for 30 minutes or longer, you may have liver failure and other organ failure, but you increase significantly the chance of death. So on-site treatment. And it works because you can get, basically the core body temperature down a degree of Fahrenheit in about 3 minutes. So if you recognize it early, measure the core body temperature with a rectal thermometer and start the cold water immersion with an ice bath and fans that are going over the athlete's body, you can get that core body temperature down below 104 degrees Fahrenheit within 30 minutes. And you may save the life of that young football player or basketball player or whatever the sport. It's probably going to be football, but it can occur in sports like track and cross country and other sports as well. Now, I write a lot about exertional heat stroke as it pertains to one of the more famous cases that ever happened. I'm not going to necessarily talk about that here, but I discuss it in my new book, That's Gotta Hurt: The Injuries That Change Sports Forever. And I talk about that injury, but then I talk to what has basically come from that and all the terrific education. We talk about prevention, acclimatization guidelines, hydration, things like that. We talk about this treatment and getting core body temperature down so that we can save the life of every young athlete that plays sports in hot and humid conditions. definitely check that out. Below this video, there's a link, tghbook.com, where you can get links to ordering it on Amazon, Barnes & Noble, Books A Million, Indiegogo, Powell's, and you basically can order it and it'll get sent directly to you. If you order it before June 6th, you'll get an email confirmation. Copy the order number, go back to tghbook.com, paste it into a form there, and you will get signed up to get all kinds of really informative, entertaining, really honestly helpful content, ebooks and courses that you'll get absolutely free if you pre-order That's Gotta Hurt before June 6th. I think this book has a very, very important message, whether or not you just are a sports fan, but more importantly, if you have kids that play sports, or you just like to play sports or exercise yourself, it really is important in talking about ways that you can stay safe, stay active, but perform your best and stay out of the operating room. I think you'll really, really find it valuable. I think it's really important. That's why I'm trying to encourage you to get it now and get all these free bonuses as well. That's Gotta Hurt, the injuries that change sports forever. If you have friends who play or whose kids play high school football, college football, even youth football, share this video with them because they need to know about the risks of exertional heat stroke and what can be done to prevent that. So please share this video. Get the book, That's Gotta Hurt, the Injuries That Change Sports Forever. And I look forward to seeing you right here next time.